So I'm at the Oceania Tobacco Control Conference in Perth, talking to Professor Alan Lopez from the University of Melbourne, who set the scene really for everybody here today on where we stand on tobacco control, basically globally, regionally and in Australia. What's your big message in terms of the burden still?
Well, a couple of key messages. One is for the individual, and that is smoking is about the dumbest thing you can do if you want to stay alive. The risk of a smoker dying from tobacco is about 3 times that of a non-smoker. That means that if you start to smoke, say in your early 20s or late teens, and you continue to smoke, then you've got a 2 in 3 chance of smoking killing you, and it'll kill you well before old age. So that's one big risk. It's not like crossing the road. It's not like getting struck by lightning. It is really, really big and really, really different. So that's one message. The other message is really for governments about what tobacco does to the health of their populations. Death in old age is inevitable, but death in middle age is not inevitable. It ought to be avoided. And tobacco is one of the big drivers of death in middle age. And so my other message is tobacco can kill about 35 to 50% of people who die in middle age, countries like the UK and Australia, back when the epidemic was at its peak, died as a result of tobacco.
Now, the peak has shifted in Australia now, has it?
It has indeed. Tobacco mortality, the consequences of tobacco smoking, peaked in Australia in the late 70s, early 80s. When it peaked, 1 in 3 Australian men who died in Australia, say around 1980, was killed by tobacco. And I use that phrase, killed by tobacco, because tobacco is an extremely hazardous substance that kills people. And so 1 in 3 Australian men in the early 1980s, in middle age, died from tobacco. Today, that figure's down to about 20%.
Now, your warning at the conference was, especially with a lot of people from around the Pacific there too, was that the peak is now shifting in other nations and regions. Where are the issues?
Well, I think the big regions where it's shifting are the regions where large fractions of the male population in particular began to smoke 2-3 decades ago and continued to smoke. So we expect that those males in those populations will experience the same hazards as Australian males did, as the US and the UK. So China, Indonesia, Vietnam, India, populations nearby, and also in the Pacific Islands, Papua New Guinea, Tonga, we've got 40-50%, half the male population are smoking. Well, if they continue to smoke, they will begin to die in large numbers, just like we had in Australia and the US and the UK 40 or 50 years ago. Those epidemics are not at question. They will happen. The real question is when.
So are we seeing a gradual and rational shift in tobacco control policies across the world in taking up from the countries where it has worked?
I think what we're seeing is that lessons that we've generated in countries where it has worked are forming the basis of tobacco control dialogue in these other populations. The problem is that the governance in these populations, the health promotion policy environment is not near as strong as it is in countries like Australia. So as a result, we do not get these policies set in place effectively, comprehensively, and hence we don't see much of an impact yet.
And can you explain particularly the risks that we're facing in the South Pacific areas, but in particular?
Well, the same risks we faced in Australia. If 40 or 50% of men in places like Tonga or PNG are smoking cigarettes and continue to smoke cigarettes, then 2 in 3 of those are going to be killed by tobacco. And half of those deaths are going to be in middle age, half of those a little later in old age. Those risks are going to be, we think, essentially the same.
But what's stopping governments from taking action now?
I think it's the general governance issues, the lack of understanding that this is really important as a public health issue. I think there's a lot of concern still about maternal and child health. Now, that is important, but it's not the only thing that matters for government health policy. So I think governments are not understanding the urgency of tobacco, that it's the large fractions of the population who smoke now who in 2 to 3 decades or even before will experience large health problems, including avoidable deaths.
What can Australia do?
I think we should continue to demonstrate at home domestically the effectiveness of bold public policy. That's what Australia is known for. We do it very well, and you can see the population health impacts. They're fantastic, what we've achieved in Australia, New Zealand, the UK. So that's one thing. But I think also our foreign aid, our foreign policy towards neighbouring countries in terms of foreign health aid ought to be more expansive. It needs to move beyond keeping babies alive and mothers alive only. That's a great thing and it has to happen, but it's not the only challenge.
Has tobacco control been affected by the cuts in foreign aid in recent years?
I don't know, but I suspect it has. I suspect it's an easy target. It's just because the government aid program cannot not invest in keeping women and children alive. That's an international obligation, and it's correct. But where I imagine that the cuts are being made is where the easy programs are. Well, NCDs, that's an individual responsibility. Let's cut aid there.
Now, and to finalise, because I know you have to run, you said that we have had 100 million deaths in the past century related to tobacco. You had a pretty terrible prognosis ahead. What are you anticipating? And is it just if nothing happens?
If nothing happens on current trends, that's the volume, particularly of young men who are smoking in developing countries. We're 40-50%, almost half of men in developing countries are smoking. And they're now smoking to the point where they're beyond the age, in many cases, where it's easy to quit. Doesn't mean they can't quit, but it's going to be harder. So if they're going to continue to smoke, we will begin to see annual tobacco mortality of about 10 million a year, sometime in the 2040s, 2050s. In the next 20 or 30 years, it's going to go from 6.5 million today to 10 million then. If it's 10 million by the 1950s, it's probably going to be 12 to 15 million in another 50 years' time. So if you average that out over the century, that's 1 billion people. That's a lot of deaths.
That's a very sad note to finish on, but I thank you very much for your time.
Very welcome. Okay.